Message, 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 message. Healthcare simplified.
Okay, I think we can begin. Hello everyone, my name is Kalwila Ching'embu. I'm a pharmacist in the public service, and today we'll be talking about acne and treatment options. Yeah. So if you have any questions or clarifications, just post them in the comments and I'll be able to respond to them at the end of the discussion. Okay. So acne. Okay. So acne is something that most of us have experienced or suffered from puberty. So in most pubescent teenagers, acne usually is the first sign that we see, and young boys or men are affected more than women, and it can continue throughout puberty and all the way to the 20s and the 30s. Yeah. So acne can either be inflammatory or non-inflammatory. So most of us usually have the non-inflammatory, unless it gets very severe, then it can be inflammatory and very painful and a cosmetic nightmare. So today we're going to discuss acne vulgaris, which is the most common human skin acne, which affects the face, and the neck and the back, also the chest. So acne is caused by usually sebaceous glands, very active sebaceous glands in our skin, and mostly when your pores get clogged and sebum, which is produced by sebaceous glands, accumulates within the pore. It may bulge up and eventually become what we call a commodore. Now, a commodore can be either open or closed. So an open commodore is the one that winds up becoming a blackhead. So when it's open, it reacts with the oxygen in the air, and the melanin and the keratin in the commodore react, and it becomes black. It's not necessarily dirt as we often think it's dirt, but it's the reaction of the oxygen with the sebaceous fluid, and yeah. So like I said earlier, men are affected earlier, more severely than women. In girls, the occurrence of acne may be caused by the changes in the menstrual cycle. So in women, acne may fluctuate. It comes and goes throughout the month, but for men, it's mostly just constant and lasts throughout. Yeah. So like I said earlier, the primary site of acne is the face, sometimes the chest and the back, because of the various large amounts of sebaceous glands in these areas. So when acne gets really severe, that's when it will affect the back as well as the chest. So the inflammatory lesions vary from small papules to pustules, which become large and have pus in them. That's why they're called pustules. Those are the ones when you squeeze, it comes out. There's that worm-like fluid or excrete that comes out. Those are pustules. And there's also nodules. Those are the ones which are hard on the surface, but still very tender on the inside. And the inflammatory one is quite aggressive and painful on the face, and it's the one that requires treatment, antibiotic treatment and other treatments which I will discuss going forward. But the non-inflammatory one is usually self-limiting. Once the pustule pops on its own or is popped by the person, it will release its contents and it's self-limiting. But the inflammatory one usually is prolonged and is painful and will require treatment. So the causes of acne. The first cause is genetic. So you find that some people may never experience acne because their genes are not, they don't have that gene for acne. And then some, regardless of treatments and cosmetic therapy and whatnot, acne will stay with them throughout their 40s even. So it all depends on what genes you have, and if acne is present in your family, then most likely you will suffer from it as well. The other cause is hormonal, like I mentioned earlier, the changes in the menstrual cycle. But at puberty, androgens, sex hormones, which are called androgens, are triggered and they start being produced more rapidly. So androgens have an effect on sebaceous glands. They cause them to enlarge and they cause them to produce more sebum, which will further cause acne. Psychological circumstances may affect acne as well, to a smaller extent than the other causes. Also, drugs. Some drugs may cause a reaction of acne on the face, which I'll get into later. And also diet. High-fat diets might cause acne in some individuals. Diets that contain a lot of milk have been known to cause acne or to worsen acne in most individuals. So acne develops as a result of blockage of follicles and hyperkeratinization, which forms comedones. So hyperkeratinization is where the skin is producing a lot of keratin, which blocks the pores. And when the pores are blocked, they won't be able to release the sebum from the sebaceous glands. The sebum will accumulate in the pores and cause them to enlarge, and that's what we'll see as a comedo, and later will turn into a pimple, which is later on into a pustule or a nodule. So there's also menopausal acne, which comes up when there's a decrease of production of ovarian hormones in women. So some women may experience an onset of acne when they reach menopause because of the low production of estrogen inhibitor. So the higher levels of estrogen in a woman's body, the lower the levels of testosterone. And as I said earlier, testosterone is one of the androgens which exacerbates acne. So when there's a lower production of estrogen in the woman's body, there's a higher production of testosterone, which will cause the onset of acne. So the classifications of acne. So there's mild acne. Lesions are simple pimples and predominantly comedones. These are the ones I was mentioning earlier to say they are self-limiting, and eventually they pop and will leave no scars on the skin, like it was never there. The moderate lesions are papules and pustules, the ones which usually have pus in them. These may turn into inflammatory or can also be self-limiting and not cause any scarring. Then there's the severe lesions, which may generate from pustules and into nodules and into cysts. So when they become cysts, that's when they are really painful and inflamed and will accumulate a lot of bacteria in them and will require treatment. So let's go now into the treatment of acne, the treatment options that are there for acne. So acne will be treated according to the type of lesions that are appearing on the skin. So we can't impose aggressive treatment for a mild pimple or pustule. So mild acne, the first of all, before I go into classification according to type of lesions, there are 3 types of treatments or treatment options for acne. So there's the use of retinoids, there's the use of antimicrobials, and therapy. So there's 3 types: retinoids, antimicrobials, and hormonal therapy. So those 3 treatment options will be employed according to how severe the acne is on the patient. Yeah. In this case, we're treating a patient in case a patient has come into seeking for treatment for the acne, or in the pharmacy, or in the retail pharmacy, or in the hospital setup. So for mild acne, the first choice is benzoyl peroxide, which is an antimicrobial. It's a topical antimicrobial. I will go into the 3 classification treatment options and explain them as we proceed. So the second choice is vitamin A derivatives, which are retinoids. The third choice would now be oral antimicrobials, which may include tetracycline, clindamycin, trimethoprim, and erythromycin, azithromycin. Yeah, so that's for mild acne. Moderate acne may employ systemic treatment with oral antibiotics with addition of topical drugs. If no oral antibiotics is being used, topical therapy may be used on its own and will produce results. So the first choice as well for moderate acne is benzoyl peroxide, which is, like I said earlier, an antimicrobial, and it's the first choice because of its mechanism of action, which I'll explain as we proceed. So severe acne, this is when there's no response to antimicrobial treatment and topical treatment, then you will consider this acne as severe. So the first drug of choice is isotretinoin, which is a vitamin A derivative. It's a topical form of retinoid, and it's in the second class of retinoids. It's one of the best, the most efficacious retinoid. So isotretinoin may be used for 4 to 6 months, which is quite a prolonged time. But for treatment of acne, you find that every type of treatment that is employed will be used for a prolonged time, because you want to see the results, and you can't see the results in a short period of time. So topical therapy is one of the first line of treatment, even when you go into any drugstore or a doctor's office. They will emphasize to say, we'll try topical first, and then we proceed to oral antibiotics or topical antibiotics, and then hormonal therapy. Hormonal therapy is usually the last line of treatment, and it's not used on everyone because of its side effects as well. So let's go into the 3 types. Let's classify them and talk about them in detail. So let's start with antibiotics. Which antibiotics are employed in treatment of acne and why? So you find that mostly it's the tetracyclines that are used for treatment of acne. So we've got doxycycline for gram-positive. It has its effect on gram-positive bacteria. So in the Commodore, let me go back a bit. In the Commodore, when the sebaceous glands produce sebum, sebum attracts bacteria, gram-positive bacteria, which is what will cause the inflammation and cause the acne to become severe. So that type of bacteria thrives when there's a lot of fat in the Commodore. So the more the fat, the more the bacteria thrives in the Commodore. So the antibiotics are there to treat that bacteria that is in the pimple, in the Commodore. Yeah, that's why we're using antibiotics to treat this. So we mostly require gram-positive antibiotics because it's gram-positive bacteria that is found in acne, mostly severe acne. So for doxycycline, for adult dose, it's 100 milligrams once a day, sometimes twice daily. So for this treatment, you can treat for up to 2 weeks with topical treatment as well. So you put the patient on doxycycline, and then they're also using topical creams, and after the 2 weeks you assess to see if it has helped, and if it hasn't and the acne is still severe, you can switch to something else. So the side effects of doxycycline may include GIT effects, diarrhea and vomiting are the most common ones. Yeah. So tetracycline may also be used, although in our setup tetracycline is not often used. You may not even find it on the market out there. Most likely they'll prescribe doxycycline. Azithromycin is one of the antibiotics which can also be used. Can also be used for 7 to 14 days, and then assess the patient to see if they're responsive, along with topical retinoid cream. Yes. So some of these drugs are contraindicated in pregnancy, so pregnant women are not advised to use antibiotics to treat acne if the acne is very severe. Mostly when a woman is pregnant and they're experiencing severe acne, they'll just advise them to try topical cream or benzoyl peroxide, which is safer in pregnancy. So the other drug that is also used is trimethoprim with sulfamethoxazole, which is commonly known as Septrin. So I know most women have tried Septrin, crushing it and adding it to their lotion. This is not the way to go about it. It's supposed to be taken orally. But in our setting, it's not advised because Septrin is used for several other conditions and may cause resistance in a patient. If you've used it for acne treatment and then you need to use it for another condition, it may be resistant. So Septrin in other setups, in other countries may be employed, but in Zambia, it may not be encouraged. So we move to retinoids. So retinoids, like I mentioned earlier, they are vitamin A derivatives. So there are 4 classes of retinoids. The first generation is tretinoin, and the second generation is isotretinoin. The third generation, there's adapalene, and the 4th generation, bactharotinine. So the classes of retinoids usually are topical, except for isotretinoin, which is oral. So isotretinoin, like I mentioned earlier, is used when the acne is very severe. That's when you employ isotretinoin. So the rest may be found in topical cream. So if you're looking for a solution for your acne, you may go to your local chemist and ask for a retinoid containing product, and they'll advise which ones they have, and most of them are topical, except for isotretinoin, which needs to be prescribed by a doctor or a prescriber, and then the patient can be placed on it with close monitoring. So isotretinoin, like I was saying earlier, you have to use it for 3 months. So every month, the patient has to be assessed. Blood work has to be done to check the liver function, the kidney function, because it has an effect on liver function, enzymes, and on kidney function as well. So the patient has to be checked before they are placed on this drug, and then they should be checked every month while they are on the treatment. So it's quite aggressive, and it's a last resort option. Yes. So also it's contraindicated in pregnancy. So if a woman is pregnant, they shouldn't be placed on isotretinoin. And while they're on the treatment, they should continue taking the pregnancy test every month just to check if they're falling pregnant or not, so that they can switch to another drug. Yeah. So it is absolutely contraindicated in pregnancy. So hormonal therapy is the third one. So we've talked about antimicrobial therapy, retinoids. Now what? Hormonal therapy. So like I mentioned earlier, androgens are the biggest culprits to causing or worsening acne. So hormonal therapy is employed to counter the effect of these androgens in someone's body. So in most women, they are placed on oral contraceptives. Men may not be placed on the same because it will suppress the testosterone too much and cause other side effects which are not really desired in men. Yeah. So women may be placed on hormonal therapy, extra estrogen in the body to help counter the effect of testosterone. Because remember, the more estrogen, the less testosterone in someone's body. So once the woman, test should be obtained first to see on what cycle the woman is on, and to see if they actually have free testosterone or a lot of testosterone in their body, if that's what's causing the acne, because it may be other causes, and then you place somebody on hormonal therapy when they actually don't need the hormonal therapy. So tests should be done, and to see if the amount of testosterone the woman has. Hormonal treatment is indicated in acne because the androgens are involved in the pathogenesis. In a female who wishes to receive oral contraception, cocipridol should be used because it contains mixture of the extra estrogen that the woman will require, or the patient will require. So again, like I said, it may only be used in a woman with elevated serum androgens, where you know that the androgens are elevated. Yeah. Hormonal therapy is completely, absolutely contraindicated in women who want to become pregnant because the risk of sexual organ malfunction in the developing fetus. So it's one of the things that should also be checked. You check if the woman is pregnant, and then switch her to a different type of therapy for the acne. So with hormonal therapy, you find that it's very limited. It's quite limited. You can only use so much on a patient. So consult your doctor or your pharmacist before you get into any type of oral contraceptives or injectable contraceptives to try and counter your acne on the face or on the body. So other drugs that may be used in treatment of acne are anti-inflammatory drugs in case the comodos or the pimples, the pustules are very inflamed, they're turning into cysts. You can use an anti-inflammatory, or pain medication in case the patient is in severe pain. These are just added to the treatment, not really treating the acne, just to help ease the pain of the patient. So we've reached the end of the presentation. Let me just scroll and see if there's any questions that may have come up. Okay, and Patrick is asking, the drug names are difficult to pronounce. How do you manage? I think it's year one of pharmacy training. You practice how to say the drugs. You don't have to learn how to say these drugs, Patrick. You don't have to, bother yourself with them. When you go to a chemist or to a hospital, when you just mention your problem or you explain what the issue is, the pharmacist or the medical personnel will be able to know that, okay, this is the treatment that we can employ on this patient, and they'll be able to help you. So if you really do want to learn how to pronounce these words, you can, but it's not necessary. The pharmacist will know how to treat you and you'll be fine. Patrick is asking again, does one need a prescription? So yes, some of these drugs that I've mentioned are prescription only drugs, especially the antibiotics. So the antibiotics, you may require a prescription. And also the retinoids, the isotretinoin, which I mentioned, is prescription only, and it has to be monitored very, very keenly. So the prescriber or the health personnel has to monitor the patient, so it definitely has to be prescription only. Okay. Can one have complications with acne? So yes, the complications that arise with acne are mostly cosmetic, like dysfunction of the face. If the commodore is very large and it pops, it may leave a large hole or a scar that may never go away. Most of us have scars from years and years that have never gone away. So that's the biggest complication with acne. So unless it goes into a cyst, then it accumulates so much bacteria that it has to require surgical removal. That's also a complication. Yeah. So sometimes the acne may proceed into something more complicated and will require surgical procedures or something like that. But yeah, mostly it's just scarring of the face where the pimple was, and yeah. So, are there any other questions? Can one use the same drug for acne on the face and the one on the back? Yes, once you've been prescribed a product, you can use it either on the face, you can use it on the back, and if it's an oral drug, of course it will work for all the acne that you have. If you take it, it will be in the system, it will work wherever it needs to work. So if it's a cream, you can apply it on the back, on the chest, as well as on the face. So there's no restriction to how you use topical treatments. Okay, so I think we've come to the end of our discussion. I hope we managed to learn one or two things. I hope it's been educative for everyone who joined in, and it's been a refresher for health personnel. Yeah, so if you need any treatment for your acne that has been bothering you so much, visit your local chemist or go and see your doctor. There's always treatments that can be employed, and once you find a treatment that works for you, the best thing you can do for yourself is stick to it. Because of the changing conditions of diets, hormones, also psychological changes, you may have another bout of acne after you've completely treated it. So just stick to what you used before, and it's most likely to work again. So if you're wondering where you can find places that have good topical treatments or antibiotic treatments for acne, you can download the MedSearch app and find your pharmacies or your medical personnel to help you with this acne. So MedSearch helps you find what you're looking for. So when you go to the MedSearch app and you search for a certain drug that you're looking for, it will show you which pharmacies have it, or you go into whichever pharmacy or whichever medical facility. If you're looking for a dermatologist, if you have very severe acne, MedSearch will help you find what you're looking for. So make sure that you download the app and you use it for whichever condition that you're suffering. If it's acne and most people think it's not important to get treatment for, always seek treatment, and MedSearch will help you do that. So There's another question here before we close. Are blackheads acne? Yes, Patrick. Remember when I said when sebum from sebaceous glands in the pore accumulates, it bulges the pore, and that's what forms the pimple. So it's called a commodore. Now, a commodore can be in two forms: an open commodore or a closed commodore. A closed commodore is the one that is called a whitehead. An open commodore is a blackhead. So when it's open, it reacts with the oxygen in the air, and that causes discoloration of the contents of the commodore. So that blackness at the top, what we call a blackhead, is because it's an open commodore. It's still acne, it's still a pimple. Yeah. So thank you very much everyone for tuning in. This is me signing out. Thank you.